Too much. We're getting on the floor. Yep, just like this. Perfect. Okay, so formal hand dressing is a pretty anal thing for hand surgeons themselves. But most hand surgeons agree on one thing. 14 fluffs. That's what they want. What's a fluff? It's a 4x4 peeled out and fluffed. Okay? And you have a thing called tweeners, which is what they actually want. They want one or two in each web space of the hand. Okay? It's kind of like a bulky Jones for the upper extremity. It can be with a splint. It could be without a splint. Does that make sense?
Mm-hmm.
It could be just, we do this for trigger fingers, carpal tunnel syndrome, finger lacerations, wrist lacerations. It could be treated, but you could use it for many different things. At Kaiser, we use a combination of soft roll with it, although you don't necessarily have to. So I start with a fluff in between each web space. I'll throw two down. In the thumb. One in between each finger. Hint that why when we stick anything in a cast, we always stick something in between the fingers, right?
Yeah.
We will take one or two straight 4x4s, and that will be what goes over the wound. Wherever the wound is. If it's a dorsal, if you did an extensor laceration, you might include all the fingers, and it would be an extension. If it's a flexor laceration, you would include all the fingers, and it would be on the volar side. Got it? Most common right now is anything from trigger fingers to carpal tunnel syndrome. So I would just go right over the incision with your straight 4x4s, your fluffs. The remaining fluffs, you'll put some in the back, some in the front.
So this is post-surgical, this person's out.
This person's out. Although I've done it in the emergency room. Again, just a bulky Jones. You don't have to use soft roll. You guys use soft roll on yours?
No.
You can go straight web roll. And if I was going to include the fingers, this is what I would do. Then web roll. And again, you compress with the web roll.
So do you want us to do it how you did it on the
I want you to do it just like this.
Okay.
Again, you don't have to put a splint in it at all. But tonight you guys will probably, I think it's best that you guys at least do a volar splint. Remember how to do that, right?
Is that how you roll flat?
I think there's gonna be some kind of
If I was including the fingers, again, I would take it all the way up on the front or the back. Again, doesn't have to have a splint.
When is the splint usually ordered?
Depending on what it is, and the doctor will tell you. Again, I just did that. But Feel like day one of class? First week
Very
maybe?
nostalgic.
All it is adding a bunch of fluffs. Knowing that they want tweeners, meaning one in each web space, a bunch in the front, bunch in the back, creating bulk, absorbing blood is really what it's all about. If you take something wet, okay, it's like a wet to dry dressing. Have you heard of that yet? So if you take a wound that's open through the dermis, okay, a lot of times they'll do a wet to dry dressing to help it granulate in. They take a moist sponge, 4x4, 2x2, dip it in saline, stick it inside the wound, not up on the edges of the wound, inside the wound. You take a 4x4, a dry one, a bunch of them, and stick it over top of that. And what that does, the dry one absorbs the moisture, and so it's pulling stuff out of the wound. Wet to dry dressing. You can do dry to dry dressing. Dry to dry dressing would be like a wound that was scabbed. You just put a 4x4 over top in case it opens. Maybe it was it's stitched up and they didn't want to wait another week to pull the stitches. Do you have to go put more of that ointment, non-adherent dressing on it? No, it's all dry. Put another 4x. You don't need a non-adherent dressing. You could do a dry to dry dressing. Open wounds, wet to dry. They got all sorts of stuff out there right now that they can do. As far as, but it's basically the same function. Now, granted, what if you put plaster on top of the wet to dry?
So it's gonna suck up.
It'll even do better. It'll suck moisture away even better. Hence why we do plaster in the operating room. Once it starts filling with blood, it sucks it right out. Not unusual for someone to come, if you put a cast on in the operating room after surgery, they'll come back and it'd be a big red spot. They'll go to the emergency room. I'm bleeding. You take off the cast, it's beautiful, pristine inside. All the blood's outside. Got sucked right out. Plaster does that. Fiberglass holds it close. Not so good. Not for wounds. Plaster works pretty damn good in the operating room. That's why they do it. The bulk, same reason. You're wicking moisture, blood, serous fluid, all that stuff. You want it away from the skin. Okay? Formal hand dressing. Give me one of these. We go home.
Hey Chris,
Yes, sir.
how many of the 4x4s did you use for the hands?
A one in between each finger?
No, I mean
No,
like,
on the
without,
wound.
without being fluffed. Like on
Two.
the-
I use two.
Just two.